It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. And I'm your host, Bob Roth, and we're coming at you live from the Scottsdale Air Park. It is Friday, June the 23rd, and we got through a record heat week here. And the dog days of summer are certainly upon us. We set a couple of records, tied a few records, and today I don't think it's going to be quite 120. I think they're talking about 112 or something like that. So that's kind of respite for us. And most of the country who's maybe tuning into us on the internet is saying, 112, are you kidding me? That is hot. Well, 118 is really hot too. So this show that you're listening to right now is called Health Futures. And what is Health Futures? If you're just tuning in for the very first time, Health Futures is a show about how our older adult population can live a healthier, happier life. And I'm able to do this by bringing extraordinary guests to the show. We've been on the air now for 4.5 years. And we've talked about a range of topics, anything from diseases to assistive devices to helping people financially plan for the inevitable, as well as arranging plans, memorializing your wishes and putting them into place so that your loved ones will know what your wishes are when you can't speak for them. So I want to just jump right into the show here. I've got a repeat guest, and she and her company are doing some extraordinary things. And I've said it on their show before, aging is something that is upon us, and it is happening at a very rapid rate. Yes, we all know the statistics, 10,000 people a day, baby boomers. The oldest of those baby boomers are now 71 years old. And the youngest are, somewhere around 53, 54 years old. So, we're aging at a very, very rapid rate. And as a result, we're learning a lot about aging, and we're learning that we're not ready for this. And when I really look at it, I look at it as saying, our show and what we do at Cypress HomeCare is to try to come up with solutions. And I really see three cornerstones to really coming up with a solution, called a three-legged stool. The first and foremost is people. We need to get more and more people into the healthcare field, to the caregiving field. Two, we need public policy. We need our government to really take note of putting some programs together to help these families that are really in crisis mode with the aging of their loved ones. And then lastly, and we talked about it on our show last week when I had Richard Philly, who is a professor at ASU Engineering School, part of their entrepreneurship program. We were talking about innovations in technology. So if you get your arms around it, people, policy, public policy, and innovations in technology. And our guest here today, Jennifer Drago, who's the Executive Vice President for Population Health for Sun Health, specifically their program Sun Health at Home, is utilizing two of those three barstool items that I'm talking about. People and really changing the face of policy. So Jennifer was a guest here on our show 11 months ago, almost to the day. We had you on July 21st, 2016. And this thing that we called Sun Health at Home was relatively new at the time. And she's got nearly a year under her belt. And I want her to share with our listening audience what Sun Health is doing and what is this Sun Health at Home all about?
Sure. Well, thank you very much for having me on again. It's always a pleasure to talk about what the future of healthcare looks like from, the perspective of you and myself, where we've been doing this for a number of years, specifically in the Valley and specifically working with seniors as they're aging. we get to see firsthand what the issues are. Sun Health, I'll just start there with a kind of an organizational overview of who we are for those that don't know us. We are a nonprofit community-based healthcare organization. We actually started some 50 years ago as a hospital system. We owned hospitals in Sun City and Sun City West. Those hospitals have since been sold to the nonprofit banner system. Today we are primarily a senior living organization, so we own 3 continuing care retirement communities. We own a continuing care at home program, which is pretty innovative, and that's the Sun Health at Home that you referenced that we can come back to. We operate a number of community-based health programs, which is really living out our nonprofit mission in the community, helping people to remain independent, to learn about their health conditions, and really have the best quality of life that they can. And then we have a nonprofit foundation that helps to fund superior health care as well as research in the Valley. So that is Sun Health and our 50-year legacy of serving a healthcare mission in the Valley of the Sun here in Phoenix.
Amazing. And talk about innovations. You guys are innovators. From the day you guys were born, Sun Health, into what you guys are doing today.
Absolutely. We really tried to be the essence of a community-based organization, which is identifying what the needs are in the community as it relates to healthcare. And usually when there are needs that relate to healthcare, it's because there might not be a reimbursement source to fulfill that need. And so we've had to think creatively about how do we meet that need in the community again, and some of the programs that we're doing are truly at the forefront of, helping people to, again, live independently and remain as healthy as possible as they age.
And I like, you talk about as healthy as possible as they age. And, one of the cornerstones of doing that is wellness. And you have, your Center for Health and Well-Being, you've got community education, you've got medication management, you're doing memory care navigation, you're doing a lot of stuff relative to wellness. And I've been by some of your community centers where you guys are teaching Tai Chi and yoga and, Pilates. I mean, you're doing a lot to help ensure people can live out those lives, or their lives, as healthy as possible.
We are very fortunate because the area that we are located in the Phoenix area is a retirement area. A lot of seniors that have moved here specifically to be able to retire in this area. And many of those people are very engaged in maintaining their health. And so, yes, we've modeled many of our programs around helping them to do just that. So first and foremost, it starts with education about health conditions that they may have been diagnosed with and how to live healthy with those conditions. Sometimes chronic conditions, we know that if we maintain the right lifestyle behaviors, that we can live very healthy and have a long life trajectory even in spite of having those chronic health conditions. On the flip side, if perhaps we don't eat as well as we should, we don't sleep as well as we should, we're not as physically active, we're not following, perhaps taking our medications as we should, then that chronic condition can really take over our lives in a negative way. So that's really what we're all about. For those who really wish to live the healthiest life possible, we want to arm them with all the information and tools that they need to do so.
And you're not arming them with a prescription bottle and say to take these medications. You're talking about lifestyle changes. Exactly.
So that's where we really try to complement what happens in a physician's office. So first, physicians are busy. They're going to see, many patients in a day, and they're going to really focus on what the immediate issues are and trying to bring about a resolution to those issues. But they don't have a lot of time to educate people on those lifestyle issues. So, if I have a congestive heart failure, as an example, I might get a medication. I might be told, boy, you really should lose 25, 30 pounds. You really need to weigh yourself every day, but they don't really explain why. So we pick up where the physician's office, stops. Maybe they don't have the time to do that education, and we can do that education. We have staff that can do one-on-one counseling with nutrition or exercise and really help people to understand the whys behind the recommendations that the physicians make.
And, I want to build on the counseling that you guys do. I mean, this isn't, one and done. I mean, if you need somebody, and again, this is what I've learned, if you need somebody to help you hold you accountable, kind of coach you through that, that's something you guys can provide for them, correct?
Absolutely. We actually have one of our staff members is a certified health and wellness coach. We have 2 registered dietitians who are also certified diabetic educators. Our staff has specific training in cardiac issues. We do a lot of fall prevention, another big issue for seniors. So we have a lot of additional certifications that really, again, help us do the best education that we can. But yes, you're right, we can also hold people accountable. We have support groups that help people to do that as well.
I'm going through your website, and I want our listening audience to know sunhealth.org. That's it, sunhealth.org.
Correct.
And I'm looking at, first of all, I know about the senior living communities that you have, and if you've not been there, they're extraordinary. And I was over there at the Colonnade back in February when I was there for the board and community retreat, and you guys are under construction. I mean, maybe not now, but back then, I mean, you're doing more to enhance the offerings of that community. I mean, I felt like I was in a resort. And the food?
Fantastic.
To die for.
Yeah. One of our recent one of our recent residents who moved in with us described living at Grandview Terrace, but I think all of our communities are very similar in this respect, as living on a cruise ship but without the seasickness. So you get all the benefits of having, activities, lots of people around you that you enjoy, great food, all of those things.
So I just, real quickly, and we'll pick up on the second segment when we're up on that, but the community wellness, I said at the top of the hour, we bring extraordinary guests, and we talk about, everything from diseases to helping people pay for care, et cetera, et cetera. And one of them I talked about was memorializing wishes. You've got a program called Vial of Life, File of Life. And basically, if I understand, that's something that you help people do.
Right. Those are emergency medical information pieces that help people speak for themselves when they can't.
Exactly.
Yep.
Well, it's hard to believe we're up against a break. Time just flies by. Next segment, I promise not to say so much because there's so much I want our listening audience to learn about Sun Health and what you guys are doing. You guys truly are innovators. And that people portion is very much a part of who you guys are and what you guys are all about. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. We've got Jennifer Drago from Sun Health here. She runs the program Sun Health at Home, but she's also talking about Sun Health. And when we come back on our second segment, you'll hear more. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. And we're on our second segment. If you just missed the first one, go up to our website at cypresshomecare.com. Click on the media button, drop down to the radio show, and you'll catch the first segment and the rest of the ones that we're going to be bringing you today, as well as about 160 other shows. So welcome back to Health Futures. And if you're just tuning in just now, I've got Jennifer Drago. She is the Executive Vice President of Population Health for Sun Health. And we were talking in the first segment about, how, Sun Health is really an innovator as it relates to community living, as well as some other things that they're doing that is, let's put it this way, it's breakthrough for our aging population. So I want to really just, as we start our second segment, I want to talk about senior living. And you have 3 communities, and they are, I mentioned the Colonnade. Mm-hmm. And Colonnade is in Surprise, right?
That's correct.
It's in Surprise, and it is, if you've not seen it, it is a beautiful, beautiful campus. And it sets back off of, what is it,
West Grand Avenue and Reams.
And you would never know it. Because it sets far enough back, you would never know that you were on those two big intersections, if you would.
Right. We're actually physically located in the retirement community of Sun City Grand, which is in Cypress. And we have a lot of people who, when they decide to give up their home in Grand and, don't want home ownership anymore, but decide to move on to an independent living campus, that they come to live at the Colonnade. And it is our newest community. We've just opened up 2 more villas on that campus, and they filled as soon as they were open. So it's a beautiful campus. We actually opened a recreation, an additional recreation village inside the campus called Club Soleil. It's got an outdoor pool, a 9-hole putting green, wonderful dining venues, an outdoor fireplace. It's so wonderful. And we have 2 other communities, Grandview Terrace, that is in Sun City West. That community is actually celebrating its 20th birthday.
I can't believe it.
Just this week.
Wow.
And we actually have 20 residents who have lived with us for 20 years, if you can believe that. So that's successful aging for you.
That is.
And then we have La Loma Village, which is down in Litchfield Park.
Right.
And the Grandview campus in Sun City West and La Loma also have a health and rehabilitation center as part of their campus. So they offer assisted living, memory care support, and skilled nursing.
Truly what they call a continuing care retirement community.
Correct, yeah.
So that if you do go into the hospital or you need more supportive care, you can be in that community and then bounce back into your independent or assisted living.
Exactly. That's the entire design of a continuing care retirement community. For your listeners that may not know, people generally move in when they're independent, and then every healthcare need that they have can be served right there on our campus.
I love it. Absolutely love it. That is really the cornerstone, and you said it at the very, very top of our show. Originally Sun Health got into this business. They were in the hospital business, and they divested themselves of the hospitals 10 plus years ago, and they really have been focusing on the community, and wellness is what we talked about the first segment, and some incredible things you guys are doing about improving wellness. One of the things I do want to talk about just real quickly, because as it relates to the heritage of Sun Health, one of the things that you do have is the Banner Sun Health Research Institute.
That's correct, Banner Sun Health.
And you have this incredible body donation program that's been in place for over 30 years.
That's correct. It's the Brain and Body Donation Program at the Banner Sun Health Research Institute was started by some incredibly talented scientists with a lot of forethought, and they've created the premier brain and body donation program in the country, where people basically, as they're living in their retirement communities, they are designating that, at the time I pass in the future, I want my body to be donated to science, the tissues, my brain, whatever they want to be included in that. And here's the amazing thing. The Institute, once they find out somebody wants to be a donor, they actually track them medically year after year with exams. So they know exactly what this person is experiencing health-wise. So when they do pass, they can study those tissues in depth. And the study isn't only done in the Valley here in Phoenix. Those tissues are shipped all over the world for research. And another amazing thing about this program is that when somebody does pass who's part of that program, their tissues and their brain are harvested through autopsy within 2 hours of their passing, which makes those tissues incredibly rich from a research perspective. So all those things make this program amazing. And anybody, in the vicinity of the Banner Sun Health Research Institute in Sun City can be considered for that program. So if you're interested, please look up Banner Sun Health Research Institute.
It's impressive. I'm telling you, I got chills when I was over there. First of all, you talked about going in for medical testing, but if I remember correctly, too, annually they do cognitive testing too, right?
I believe that that's true.
Yeah. So the initial premise behind it was the brains.
That's correct.
And it's gone now deeper into the whole body, and I think one of the things I learned from Dr. Beach there was the fact that one of the reasons why they're able to get that fresh tissue is that the close proximity it is to Banner Boswell and Banner Del Webb, that the bodies can get over there so quickly. And from a harvesting standpoint and tissue collection standpoint, that is extraordinary if you can get less than 2 hours, and that's what they're able to do.
That's correct, yep.
So very, very cool. I wanted just to share that with you, and if you're, our listening audience, if you're interested in all, contact Banner Sun Health Research Institute, and they can tell you more about it, and you can maybe apply or be considered for the body donation program. Mm-hmm. So the other thing that you're doing as it relates to wellness is you have a memory navigation program. And I know one of your employees, and I know of the second one, but Marty Finley, somebody I've known for years, and I've admired and respected when she was with the Alzheimer's Association, when she joined you 10 plus years ago. Mm-hmm. I thought that was a great fit, and she's extraordinary, as you well know.
Yes. Our Memory Care Navigator program, we are so proud of that program. So we spoke earlier about Sun Health crafts programs that really speak to an unmet need in the community. And we know that when people, when a family is dealing with a memory loss situation or a memory care situation, that they sometimes don't know where to turn. They don't know what's coming next. They don't even know what questions to ask, maybe what physicians would be best. And so that's where the Memory Care Navigator comes in. We have two Memory Care Navigators, Marty and Jane. Both are social services experts with over 30 years working with dementia patients and their families. And they're so well versed in resources that can support families. It's amazing. So anybody can contact them and have a consultation, either over the phone or in home. Usually works best because they can understand the home environment and really see the person with dementia and their cognition issues and what else might be going on. And they help the families to create an action plan. They link them to available resources, to physicians that they may need, and really let families know they have the support that they need.
When we come back in the third segment, I want to talk a little bit more about the memory navigation program. Michelle Toff with our company, she is one of your speakers, and you bring the best of breed to our community. And I also want to talk about, this week was also the longest day of the year, and it's the Alzheimer's Brain Awareness Month as well as the longest day. And I want to talk a little bit of the significance behind that, especially for those that are caring for loved ones, because the longest day of the year is very difficult for those individuals. It's halftime here at Health Futures, taking stock in you. We're going to take a break now. We'll be back in a couple minutes. I've got Jennifer Drago from Sun Health here. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth. And if you're just tuning in, I got Jennifer Drago from Sun Health here in the studios. She's the Executive Vice President for Population Health, and she's running a program called Sun Health at Home. And in this segment, I want to jump into that, but I just want to tell our listening audience, if you missed the first two segments, go up to our website, cypresshomecare.com, click on the media button, drop down to the radio show, and you can catch the first two segments and a whole lot more. So before I get into the Sun Health at Home, I want to talk just a little bit more about the Memory Care Navigator program and memory care in general. Let's face it, this is something that is absolutely crippling our society. It's the 6th leading cause of death nationally. It's the 4th leading cause of death in our state. Mm-hmm. When you look at the 10 causes of death in our country, maybe even in the world, every single one of them is on the decline, with the exception of dementia and Alzheimer's, mm-hmm. which is growing exponentially, and it is a scary disease. Right now, it affects about 5.4 million Americans, and affecting their families, costing over $500 billion a year. And they're talking about by 2050, it's going to affect close to 1.5 billion. I mean, it's going to cost $1.5 trillion, affecting 15 million Americans. Daunting numbers, crazy numbers. Mm-hmm. But as I said at the top of the show, Sun Health, they're innovators. They saw the need for this many, many years ago. So they have a memory navigator program. They got 2 stellar people that are leading that charge, and really, Jennifer, helping those families navigate to solutions and helping them realize that they are not alone.
That's correct. They also both are support group facilitators. So in addition to the one-on-one work that they're doing with the families, they are trying to get them, the families, connected to communities of folks that can share and let them know, like you said, that they're not alone. It's really critical that when somebody's dealing with a memory care diagnosis, and I say diagnosis, but to be honest with you, many of the people that contact our memory care navigators don't even have a definitive diagnosis. And there are many conditions that cause dementia that are actually reversible with, medications or other things. So they really, truly, if your family member, any of your listeners, are dealing with any kind of memory care issue and they have not been formally diagnosed by a neurologist, I urge them to do that and to make sure that if there are medications that can slow the progression of the disease, to get those on board, or to make sure there's not other causes of the dementia. So that's first and foremost. But then when it is Alzheimer's or another dementia, there are resources here in Phoenix. Ours, through Sun Health Memory Care Navigator, but then also Banner Alzheimer's Institute in Central Phoenix has a number of great resources. You mentioned the education that Cypress provides, and I know you do. Great in-home medical care when people do have that need.
Thank you.
So there are a lot of resources in our community. And the other one that I will mention, if somebody is listening and maybe isn't in the Phoenix area, just the Alzheimer's Association. So alz.org is a great place. And they also have case managers that can work with families over the phone and offer resources.
You mentioned, Cypress. We are very privileged, and she's been a guest on the show, and she's actually co-hosted the show. Michelle Toff, who's our director of memory care programming. We've created a program over 2 years ago where we're able to really help those families with those loved ones to be able to age in place by really putting together activity programming. And, there are 3 things that I've learned about the disease from Michelle and others that really we need to do to help stave off the illness and kind of, just delay it as long as possible. And while we don't have a cure for it, we know that if you are taking medications for Alzheimer's, we need to make sure you take them at the right time and the right doses. Mm-hmm. We need to also make sure that they're eating. Eating is a big part of this disease because somehow the brain and the stomach gets disconnected, and we have many patients that have this disease that think they've eaten, but they haven't.
Correct.
And then lastly, socialization or activities. And we think we have a pretty good program together now. It's not the solution to reverse or to keep it prolonged for any long period of time, but we have some evidence-based information that shows that we can keep them 6 to 7 months longer at home through this type of programming.
Yeah, and I'd just like to add 2 other things. If you do have somebody who in your family or that you're helping to care for that has dementia, that is in the early stages, exercise can be really key in helping to slow the progression, specifically walking and cardiovascular exercise. And that's also, by the way, if you're trying to keep your brain healthy, really important. But then the other thing is safety. And sometimes we see some really sad stories with silver alerts of folks with cognition issues or dementia that have driven away from home because they still have access to car keys and cars, and they get lost. They get disoriented and lost, and sometimes with tragic results. And so I really want to encourage anybody who's dealing with a memory issue to make sure that your loved one has a Safe Alert ID bracelet, and that perhaps if it's time to stop driving, that those difficult conversations are had.
And to something you brought up earlier, the Alzheimer's Association can help you with those safety alert bracelets to wear. Just contact them directly in your market or go to alz.org. Especially with the temperatures getting close to 120 degrees, just not just the car, but we see people with dementia and Alzheimer's wandering, and there's nothing worse than having somebody out there exposed to the elements, especially the way they are right now. The other thing I want to pause right now, as I mentioned at the end of the second segment, is that this past week it was the longest day. The June solstice set in, and it is officially summer. And we team up at the Alzheimer's Association, and what they're trying to do is really draw strong awareness to this disease and try to help raise money for this disease. So I want to pivot and talk about Sun Health at Home, and this is somewhat of a brand new program. It is. We are actually the first of our kind in Arizona and the first in the Southwest. There are 25 like programs on the East Coast. Many of them, the majority actually, formed from continuing care retirement community organizations. And this is really a hybrid of to help people age in place when they're perhaps at an age when they don't see themselves moving on to a senior living campus yet. So they're still living independently in their homes, they're still healthy, and they want to put into place a plan that can help them be able to age in place and remain as healthy as possible for as long as possible. And so we've started the first one in Arizona, started about a year and a half ago. We have 36 members. Nice. The programs that have been in existence for 15, 16 years that are some of the highest regarded in the country have about 300 members. So, being at 36 in our first 18 months is very exciting to me. We've actually expanded our marketing area. We started in the West Valley, and now we're expanding into the East Valley, Scottsdale, because the interest has been so strong. But the program is really designed to help people age in place by connecting them with a wellness coordinator, first and foremost. And that wellness coordinator gets to know your likes, dislikes, everything that you want in terms of your healthcare wishes. If you don't have family in the area, they can act as your healthcare advocate in the event of an emergency. And so that's kind of one of the ways we help you when you're well, but then we have access for those members to activities, to dining, to all sorts of health and education programs within our Center for Health and Wellbeing, including time with a dietitian, time with an exercise physiologist. So everything somebody would need to stay healthy. And then as they age in place and might need additional services, we can arrange to have in-home services brought, caregiver or companion services. And then if facility-based services are needed, that's also included as part of the plan. So it's kind of like long-term care insurance, but with a whole lot of wellness benefits built in so that hopefully people don't ever need that facility-based level of care. Well, I like the wellness coach concept or wellness coordinator concept, but I do want to say this, and we can pick up on it in the last segment because I know we're coming up to the end on the third if we don't get through it. And that is, you said they originated really out east, and they originated with CCRCs. Mm-hmm. So my vision of them originating with CCRCs is really originating, and a lot of people refer to CCRCs as facilities, but they're communities. They're communities. This, as I understand it, Sun Health at Home isn't attached to a community. It's separate. It sits out on its own. You're here promoting it in Scottsdale. Correct. And you're promoting it not attached to a facility or community. That's right, yeah, because the services actually are provided to people in their homes. I want to build more on that because I think that's what really makes you unique, because it becomes more portable, and you're not pigeonholed to a certain geographical area, locked in, and it gives you a lot more flexibility. So I'm learning more every single day. We'll learn a little bit more about Sun Health at Home, and we'll learn that from Jennifer Drago, who's the Executive Vice President of Population Health for Sun Health. It is hard to believe we're down 3 segments, Jennifer. Oh. Got one more to go, and then it's TGIF. You're listening to Health Futures, Taking Stock in You. We're up against a break. We will be back in just a couple minutes.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. We're on our fourth segment here. We're coming at you live from the Scottsdale Air Park. It is Friday, June 23rd. And I've got Sun Health's Jennifer Drago, who's the Executive Vice President for Population Health, in the studio with me. If you missed the first three segments, go up to our website at cypresshomecare.com, hit the media button, drop down to the radio show, and you'll catch the three segments you lost, and you'll catch a bunch more. So, Jennifer, I want to jump right into this because we're down one segment, and time just flies when you're having fun here. We left off last talking about Sun Health at Home. You talked about how CCRCs back east have been doing it for a number of years and have been immensely successful. You know, you've broken into this over just 18 months, and you've got 36 members. And the CCRCs that I said at the end of the last segment basically were looking to just bolt this type of program onto what they already had. And yours is very unique in the sense that yours isn't really attached to a CCRC per se, although you have senior living communities, and if people choose to go to those communities as part of the Sun Health at Home, they have that option.
Correct.
But they could go to the V Greyhawk or to the V Silverstone or Sagewood or one of the others, or wherever they needed to go.
Yes. So the beauty about continuing care at home programs across the country is that we've learned from the 25 years that these programs have been in business is that they are 96% successful in keeping people out of facility-based care. So that means, that means people truly get to do what they want, which is to age in place in their own independent home. And so how do we do that? Well, by trying to keep them well in the first place, by being their health advocate, by helping them navigate the healthcare system, and then by bringing services into the home when they need those services. So that, the only reason that somebody might need to leave their home is if they were unsafe because of a memory issue.
Got it.
Right? And maybe they lived alone and became unsafe. And so that might require being in a memory care community or facility. But so in general, these programs can exist anywhere. And they do, our members do have access to services on our campuses, as you mentioned. But if they do need to be in a supportive environment other than their home at some point, it can be anywhere, not only in the state, but in the country. Our program is completely portable. And that's another great piece of flexibility that we built into the program, because we know in the Phoenix area, many people retire here from other parts of the country, but they're away from their adult children. And at some point, as they age, their adult children may want them to be close to them in Indiana or Illinois.
We see that happen a lot.
Yeah, so these benefits are completely portable. After the first year, people can move, and we'll still continue to pay for the benefits and help them coordinate services wherever they are.
No, I love that. I absolutely love that. So if somebody wanted to learn more about this program, how do they find it? Great
question. So our website is probably the best initial source of information. It's sunhealthathome.org. And we have a number of discovery seminars, no obligation. You can come and sit with us in air conditioning and have some tasty treats and learn about the program. It takes about an hour. So the website, again, sunhealthathome.org, and the phone number is 623
I've got it right now, 227-4663.
Right. Yeah.
And it's right up on the website.
Yep.
And I do like, how you said before, you get a wellness coordinator. And even I'm up at the website. It's so easy to navigate through, and it says your well-being, your plan, your home, your home. And I think this is brilliant. And I'm glad to hear that you got 36 people under it. And if you want to learn more, as Jennifer said, 623-227-4663. So I want to cap our show here today to talk about care transitions. And you guys have done an extraordinary job with this. Please share with our listening audience. I read something in the Arizona Republic, and I've seen it in some of the trade rags. You've gotten some great recognition for the work that you've done. transitioning people into different care settings.
That's correct. Yes, thank you. So for about 5.5 years now, we've had a care transitions program, and it's really focused on Medicare patients, so seniors, who are leaving the hospital and transitioning to home. Sometimes they go from the hospital to a skilled nursing facility for rehab before they go home. But the home is the key here. So we work with patients once they arrive home, and we have registered nurses and licensed practical nurses that work with patients over a 30-day period to make sure that they have a successful recovery. And we've been so successful in doing that. One of the key measures of how you measure success is reducing readmissions. So the national statistic is almost 1 in 5 people who discharge from the hospital today will be back in the hospital within 30 days.
Repeat that one more time.
Yep.
1 in 5. So 20% of people that get discharged today
will be back in the hospital within the next month.
Wow.
Yeah. Very common scenario. Our statistics are that we've reduced that to 7.8%. So reduced it by 57%. And that one of the ways we've done that is with our terrific staff. We have registered nurses who go out and do a home visit with patients within 2 to 3 days of them coming home from either a skilled nursing facility or a hospital. And they work with patients to understand their health conditions. So they're doing education, but not in the hospital setting when people just are so tired and all they want to do is go home.
Yeah.
Right? They're doing it in their home. And at that point, somebody's been home and they might have questions like, oh my gosh, I forgot what this nurse told me to do, or how am I supposed to take this medication? So they're doing the education with folks in their home. They're helping them create an up-to-date medication list, because many times, I think the statistic is 85% of the time there's a hospitalization, there's a medication change. And so doing a medication review and helping educate on new medications is really important. And then this is really key, helping to link people to resources in the community that might help them with their recovery, but also with their long-term needs. So when we are in the home, we can help identify some of the what we refer to in healthcare as the social determinants of health, right? So the hospital is going to cure the physical issues that brought them to the hospital in the first place, but without adequate transportation, without adequate nutrition, without being able, if you can't afford your medications, if you can't afford to pay your air conditioning bill in Arizona, your medical issues are going to be compounded by all of those things. And so those are some of the things that our nurses work with patients on during that 30-day period to try to rectify, so that they can not just live healthy and stay out of the hospital for 30 days, but hopefully learn some things that help them in the future.
You know, what's interesting is a lot of times the reason why those readmits happen is because of the home.
Right.
And so many people don't get that. They don't understand that, just having them go from an acute setting to a post-acute setting like a rehab, and then booting them and going home, that they've taken care of everything, when the problem may be at home. It may be because there's no food in the fridge. It may be the environment. It may be a number of different things. And I applaud Sun Health, because you get into the home. You get to see how they're living.
That's where the magic happens, to be honest with you. That's where, and for any healthcare providers or insurance executives listening to this, I want to implore you that the magic happens in the home, when you can see what's going on and help them to resolve some of those issues that we've talked about, specifically the transportation. Sometimes there's even, we talked earlier about cognitive issues or dementia. Sometimes when somebody's in the hospital in their early stage in their memory loss, we don't detect that they can't really process the discharge instructions that we're giving them. They can't, they might say, yes, I'm going to go get this new medication refilled, but then they forget about it and don't get it done, or they can't organize their medications. So there's
or if I can add,
yes?
they have vials sitting next to their bed, or they got a big plastic baggie in their bathroom of medications.
Mm-hmm.
They got all these new medications, and they see all these, I got to take the old ones and the new ones, and they find themselves taking 2 blood pressure medicines or 2 whatever.
Absolutely. So all the work that we do in the home is really key. Again, it all revolves around education, medication review, and education there as well, and then helping to link them to resources. We follow up with phone calls over the next 4 weeks, and we're always available for questions. And the program has actually It's an amazing statistic, but because of those reduction in readmissions, we've actually saved the Medicare system $16 million since we started doing this work.
$16 million.
That's correct.
Over 5.5 years.
That's correct.
So I know, we got music. We're getting ready to end this thing. Quick question for you. If you wanted to be involved in care or transition, how do you go about doing it? Do you need to be a member of the community? How does that all work?
Well, it's primarily offered in the West Valley at this time, although we're working with some health insurers and some accountable care organizations, so we may have some increased ability to serve their members in the future. So just ask about it.
And do they call that number you gave before, 623-227-4663, or is there a different number?
The care transition, 623 832-4399. 623-832-4399.
Jennifer Drago, thank you so much for being on the show. I've learned a lot, and I need to have you back. I mean, we could unpack each one of those segments into a show unto itself.
Absolutely.
Thank you, and thank you, Sun Health. What you guys are doing is truly innovative. As I talked at the top of the show, people... we've got innovations in technology and policy. You take care of both of those. You do it great with people. You do it great with innovations.
Thank you.
Make it a great day. Have a great weekend. Thank you again. We'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress HomeCare Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com.